Anxiety disorders and preterm birth, is there a connection? So, study after study has shown that kids, teens, and adults who are born preterm, especially very early, have much higher rates of anxiety later on in life. And it's not just like mild worry, this is real diagnosable disorders, things like OCD, panic disorder, generalized anxiety disorder, social anxiety, things like that. In some of these studies, the risk was 2 to 5 times higher than for people that were born at term. And for those that were born extremely early, the panic disorder specifically shows up at shockingly high rates. That's what I have. And here's the part that matters though. It is not a personality flaw. A lot of it comes down to biology and early stress. When you're born too soon, the brain is still under construction, especially the parts that handle fear, stress, and emotional regulation. You're like then just drop straight into the NICU with bright lights and alarms and painful procedures. This separation from your parents as well, it's life-saving care and it's absolutely necessary, but it's also a level of stress that no developing nervous system is really built to handle. That overload can permanently change how your body responds to stress. So years later, when someone has a panic attack or constant anxiety, it's not out of nowhere. It's a nervous system that learned very early that the world is a scary, unpredictable, and unsafe place. And the problem here is that almost nobody talks about this. Most doctors don't even ask if you were born preterm. Mental health screening rarely takes birth history into account, and a lot of preterm born people grow up thinking that their anxiety is a personal failure, not a known, well-documented outcome of being born preterm. And that has to change. So if you were a parent of a preterm child, anxiety screening should be routine and not an afterthought. And if you're a clinician, prematurity should be a mental health risk factor that you take into account for your patients. And if you were born preterm and you struggle with anxiety and panic, it is not just you and you are not broken. It is just a real world fact that if you were born early, you're more likely to have these conditions. And here's what needs to happen going forward. We need to talk about this more. We need to be more open about it. The clinicians should ask about birth history, and as a population, we should push for long-term follow-up that includes mental health screening, not just survival. Because surviving being preterm shouldn't mean spending the rest of your life quietly paying for it.